Yeah, 1 hour. So when we officially end it, the conference call will still be open, and if people want to still have general discussions on what have been said, that will be possible. So yeah, that can be done immediately after the conference. So I appeal that, yeah, we'll have now questions. I see so far we have 2 hands up. Dr. Gilbert Laung has his hand up, and after that we'll hear from Kuban Godlove. Yeah, that's right, from Poland. Nice seeing you joining us today. So I'll just start with Dr. Gilbert. Go ahead, please, unmute, and the floor is yours.
So you're getting me?
Yes, we can hear you.
So that's good. Thanks very much for everyone for the presentations, and particularly to Robert, who did a really great job preparing the presentation and presenting it here. I just want to add 2-3 things to what he has said. The issue of sanitization and washing the hands with soaps. Why is it important? Up till now, we have never heard the word sanitization, and it is one of the most important things we have been hearing now in the last days. But what one has to know is these sanitizers, or what we call disinfectants, are either virostatic or viricide. So if you have to buy any of them, you have to make sure there are some of them which are virucidic, means it kills the bacteria, the virus, and it doesn't only stop it from propagating. But the most important thing about this is the washing with soap, because this COVID-19, the virus, has got a coat around it, which is completely destroyed with soap. So if you wash your hands with soap effectively, it is far more better than using a virostatic or virucidic sanitizer. And it is, in our context, better affordable than the soap is better affordable than the sanitizers. So now the second thing is the issue of what do we do in the face of this crisis with the young people sitting back home. They are hit with a double crisis. They cannot go to school and they have to sit at home. So making them occupied is one way of really making them also comply with all what we are telling them about the COVID. And that is why I came up with the idea with Varan Lee, Nsaibirni, to prepare a newsletter which is being presented every week on Friday to keep the young people occupied. If I can share my video on my screen, you just have a view, and anyone who is interested, please feel free to get this one, to share it to everyone, so that we can also invite all the young people to join hands in contributing, so that we would do something productive and can also learn from it with time. If I'm allowed, I will share just for 1 minute and then we're gone. Beautiful Thailand. So can you see the picture now?
Yes.
So it's just simply just we know, and when you see this picture anywhere, just know it is the we are inviting young people also to contribute, and you can get in contact with me or with Warren to bring in your contributions. Thank you.
Thank you very much for that contribution, Dr. Gilbert. So we'll move to Godlove. Yeah, Godlove, unmute, and we'll be glad to hear from you. Your question, please.
Yes, good evening, everyone. Can you hear me?
Yes, I can hear you very well. We can hear you.
Okay, given that the COVID-19, one of the great mitigation strategies is washing of hands. My question is, how effective is our hand washing, given that in our remote villages, we do not have access to running water? Even right there for us, for people who live in cities, for example, Douala, people still carry water, but from well, which means that more than 60% of people do not have access to running water, and people still have to access water from stored facilities like buckets and washing the hands in bowls and rinsing them. So the question now is, if everybody is sharing a cup to drink water and they have to touch that cup, will they not get infected more if one person just gets infected? And another issue is that when you wash your hands, and you must have been walking in town touching things, and then you come at one point and then you touch a cup or you touch a container because you want to wash your hands, you just infect everything. So the hand washing strategy with us there, if one person catches it in a household or in a community, is going to spread so fast. So I want doctor to clarify me the strategy that we can use to implement effective hand washing. For example, in my opinion, I think that we could use buckets that you puncture a hole and then you put a mechanism that they can open and use a running water from a bucket, like what they are implementing in places for hand washing. Or in another way, this automated hand washing, my analysis show that with 20,000 or 30,000, you could implement a fully automated hand washing system that you don't need to open the tap, where you just need buckets. Maybe you have a 100 liters of container and then you have small pumps. You just come and you place your hand and you wash your hands. And even a hand sanitizer will be the same way. You don't need to be touching things. Those things are so cheap in a way that it just needs initiative. And given that we don't even have energy, for example, if we have implemented in sometimes for 2 months there is no electricity. And my analysis with a friend of mine that we were doing, it shows that with 50 to 60,000, that thing can be set up. And imagine that we could set up in strategic locations in the quarter where people can access it and wash their hands before going home. It's more effective because we do not have access to running water, and it is something that the committee in charge of this coronavirus should spend a lot of time thinking of how effective can we implement this hand washing strategy, because it actually works. And another issue now is, if people see made in Njangi houses, like we know our environment, because the government says people should not meet up to 50. It becomes a problem when people meet in a small building where they're holding a Njangi or Manjong and say that they are respecting the recommendation of people not meeting more than 50, or maybe a small church building. It is still not effective. So the recommendations we have to really observe it, how we can implement it in our context to be an effective strategy. There are a good number of them, and there's no time for me to discuss them, and I can try to contact them if need be, and we talk about it, these kinds of strategies for mitigation, because that is the only way forward. Thank you.
Great. Thank you so much for your point. The last person, go ahead, Warren Lee, and give your contribution. You just need to unmute. Yeah.
Okay. Thank you, President.
Your voice is a bit on echo. We cannot hear you very well, so we want to try again.
Do you hear me, President?
Try again. It's a bit better.
Can you hear me now?
Okay, quite better. Go ahead, please.
Can you? Okay, good. Okay, so I was thanking Dr. Robert for the brilliant presentation, and also congratulating NSODA for the task force against COVID-19. I think my worry is not different from what I have held in the past. How are they measuring the potential of our own traditional health care systems, in response to COVID? In their plan, do they have these people on the role, are they thinking of grouping together our own practitioners, the herdsmen, if you want, to let them also, delve into the issue, or are we depending only on modern medicine for our response to COVID? Because I'm still the believer that since this relatively new.
We lost you.
You viewed from the experience of the experience of China with.
Yeah. Lee, we did lose you a bit. Yeah, okay, try again. We did lose you a bit and we didn't catch all that you said. Maybe just, yeah, you were talking about.
Okay, yes, I'll try to be quick. The network is breaking. Yeah. So I was saying, looking at China, you'll see that they got their tribal practitioners on board in the response to the COVID. So, being one of those great tribes with a very strong and potent traditional healthcare system, though we have not given a lot of attention to this, but during the cultural week, we noticed that there is a constituted body which can be harnessed and directed to give a traditional look at it. And we don't know, we could have a breakthrough, no one knows. So I was just thinking the task force should very much consider constituting and organizing our herdsmen to come together. I think Mr. Binfon also spoke about that last time, the potential of our traditional medicine and our greenery. So I think we should involve them very much in this fight. I think that's the contribution I wanted to make. Thank you.
Thank you very much for that contribution. Go ahead, Dr. Robert, and comment if you want to. And I think,
I think, I would comment, and then I would, the other members of the COVID task force can also come in. Yeah. Very brief. The first question from Godi. I think Godi was more very providing solutions than questions. So if you don't mind, Godi, you should join the task force because you seem to have so many ideas about how to effectively implement hand washing, which is like the most important aspect of this preventive measures. And to Warren, it's a very great idea. Of course, the Chinese, they use their traditional healers. They have a good framework under which the traditional healers work, and it's very easy to leverage on that to have them very effectively participating in the coronavirus response. And it depends on how we want to do. I think the members of the task force would actually comment here, but NSODA's approach is more towards prevention. The traditional healers come when people are already sick and it's already treatment. The government has set up strategies for treatment, and we are very much hopeful that NSODA will not have to arrive at where we need to treat. But as you rightly said, we'll see how, it's not a bad idea to see how we can in our traditional healers. If for treatment, we can maybe already tell them to start seeing how, maybe preparing themselves and organizing themselves. But then we have to see how that fits into the government, because this is a pandemic, and the person who has the last word on how people are treated and so on is the Ministry of Health, and we don't want to get in cross hairs with them, So I think SODA for now is more towards prevention and implementing some of these barrier measures, and we can see about the other one if it's possible for us to engage in. I don't know if any other member of this task force has a comment.
Yeah. I think I'll just add that for me, I think you did talk about, Godlove did mention about water taps. I think you were mentioning what you've done so far in regards to that. I don't know if you would like to comment on that. If you can hear me and for me. Yes. No, I think we lost Yeah, his connection. Yeah, but that's something that he mentioned that we were doing already. Let me see. I think for me it's not here. Yeah, we lost him. So that's one of the comments he made on what they were trying to do. And the other thing I just want to highlight is the other thing is when we talk about we need to provide mask, soaps, and all these things. It's, you know, our people have been in war for so long, and I think sitting here for a very long time, you can be thinking, or for people who are not really so on, which is where many of us sitting here today are. But if you were to go back to and see the set of conditions people are living in, it's really, really very difficult situations. And the president also, our president general did share some pictures. He was going to comment on them here. I just want to move to them so that I'm sharing them on my screen for those who can see the screen. Let me try to bring that up. Yes, for those who can see the screen, I will just ask you to, you can see the sort of situation that these are people who have run away from war, and a mask costs 300 francs, but people no longer are not even able to have, from what you're saying, to even have, you can go for a week and you don't even have that amount of money. And now you have to spend it on a mask. And if you don't have a mask, you are getting a fine of 6,000 francs. I think that's what I read. So these are the sort of conditions that people are living in. Let me look for another one here. These are pictures of people of health personnel who go to see people living in kind of I think, yeah, I think you can see that right in bushes. So this is where some of our population. Let me see if for me is here. He really did elaborate on this. And so this is what some of the people are living in. So when we're talking about and we're talking about the sort of help people, you know, if they are asked now to wear masks, they are asked to wear to wash their hands regularly, and then they don't even have the basic needs of survival. So we can imagine the amount of burden that has come to our people, and for us who maybe have been able to escape this this sort of calamity, I think we have a responsibility to do more. So the idea is for NSODA to provide some of these things for free, and of course that will come with funding. So maybe I know that if there are people who could be interested, there are local chapters everywhere, especially those in here. Maybe I'm talking of Europe, and maybe if we could come together and have a discussion of what can we really do to support NSODA in this issue. I think they can help a lot and do something for people, because if the pictures that I've shown, when I saw these pictures, I really realized that it's much more bad than we think. So I think that's the comment I'll add in regards to that. Basically, I think, I don't know, Dr. Gilbert, if you have something to wrap up, and then on that, I'm just looking to see if, yeah, I noticed for me is here now. Please, if you can comment. I was just sharing some of those pictures that you had. I'll appreciate. I think you're on the ground and you have more for us.
Yeah, thanks very much, Presi. Are you getting me?
Yes, we can hear you.
Yes, the pictures you have. Sorry, my line went off. I was off for about 5 minutes, but I'm there now. So the pictures you're having there is just to let all of us know that the situation in SO is not as we thought. I think it's more serious than we think. Those pictures are just one of the few bushes that people have escaped from various villages in SO, and they have gone to. And here is a village called Nka, not really a village, it's a bush place, somewhere around Wainama. And there are so many of them. I think I have lots and lots of pictures which I could share with anybody who wants. And there are about 10 of such bushes that some people are living in really terrible situations. And we are trying to reach them, There are some other, there is Nka, which is around Wainama. There is also Bell, some villages around Bell. And then there are some bushes around Aftenbokam. We just did some survey there, and there are more than 400 households in that place. And then there are some around after Mbiami, right down, some around Bonso, Nkuf, and some people are living in really, really appalling situation. And there are some of them in huts. They've been there for almost about 6-7 months, living in huts, no water, no bed, no mattress, in really terrible situations that for those who are interested, I'll be willing to share with you. And I will tell you that there are more than 10,000 people living in bushes now. Sometimes when you are passing, and the pictures are really, really very serious, and you see some of them lying on bare floors and so on. And we gave them some assistance. Actually, we gave them some mattresses. We provided about 500 mattresses to the different locations, and then we provided. We treated them for malaria, and in some places where you went to, we did some tests for about 300 people, and almost all the 300 were malaria positive. And then we also treated, we dewormed some children, and then we gave some iron drugs to pregnant women. So the situation is really, really very serious. No water to drink. We're talking about water. Unfortunately, I didn't share the pictures of water, but there are so many of them. So the situation is really demanding, and it needs a lot from us. And the only thing we need is synergy. We need everybody to work together. And I want to say that NSODA is not a group of people. NSODA is us. So if you're in Soman, you're in NSODA. So, and all of us need to really work hard to see how we can assist these people. Presently, NSODA is working with Shumas, and they are doing quite a lot. But we are really requesting people of goodwill so that we can join together and see how to help our brothers and sisters. It's not only, yesterday was just the fact that they are not going to school, but today is more serious than we thought.
Great. Thank you so much.
So if your question, I think I would like to answer the questions. Great.
Yeah, so I don't know if anyone has a follow-up question again, I noticed, yeah, I'll allow the president of Benin, Kilian, can you come in, please? You can unmute and come in. We cannot hear you in case you are speaking, Kilian. Yeah. Yeah.
No.
Yeah, we can hear you now. Go ahead. Yeah.
All right. Okay. I'm just thinking in terms of the local chapters who are ready to help. What are the key areas of needs that we should concentrate on? And how can we coordinate around that so that to make sure that we have the synergy that the president is talking about?
Great. Thanks for that. For me, will you want to come in into that?
Yeah. What I'm thinking is now there's a task force that is created. I think there are 4 of us. So in terms of assistance, I think Dr. Robert brought quite lots of things that we could do. There are things like masks, and we are thinking that the next step would be to identify some tailors in different villages. We could say in one subdivision, we identify a tailor where we could maybe subsidize, and they produce so many masks so that we are sure that our people are having masks. And then the second is helping them maybe with the production of nsabulu, not necessarily soap. In some places we could give soap, but where it's possible, not possible, we could train them how to produce nsabulu. We get those who know how to produce nsabulu, and we train them on how to produce the nsabulus so that we could distribute to all the, especially to me, I feel the most vulnerable to me are these people who are living in forest now. The rainy season is coming, but you see that they are still living in forest, and some of them, it's not a small number. And I just took the case of Nku and Aftenbokam. 400 households. If we take, for example, that there are just about 3 of them in a household, 3 times 400 is already 1,200. And I think 3 is just the minimum. They will almost be about 5 per every household. So if we could help them with those sabulus or the soap, it will also be good. And then it could help them, give them more, maybe help them with containers where they could harvest some water and initiate the hand washing. Or we could try, as Dr. Robert was saying, we try in some places where we could try to put water containers and then maybe some taps so that they could wash their hands, or provide them buckets, or help them drill wells so that they could have some water from there that they can use in washing, because water situation there is still very bad too. And then there's also a possibility of, presently what we have done is in these villages that we have trained about, in Ku, for example, we have trained about 3 community health nurses, health workers, excuse me, and 1 nurse. And they are there already sensitizing these people. So we could exploit these potentials, because they could exploit these community health nurses. I could send more photos when we finish. We could exploit them so that they sensitize and help these vulnerable communities so that they could be able to fight against the COVID. So there are so many of such initiatives that we have put on place, and we will be sharing so that those who are willing could contribute. And if you want to join, there are still 4 of us. It will be good that many people should join. We could then form a committee, and this committee could be able to put in place some of these actions, and then suggest many other actions that we could be able to take.
Okay, thank you so much for that input, President. I think I see Ray and Andy, you have your hand up. So Ray, please come in, and after that we'll hear from Andy. I see Ray, unfortunately your mic is not on. Let's just move to Andy. Please, you can go ahead and we'll come back to Ray. Yeah.
Yes, can you hear me, please?
Great, we can hear you.
Okay, what I was saying is that since NSODA is already doing a formidable job, it would be better that we should rally behind NSODA and see how to support. And then one other thing that I was also thinking is that for this agricultural venture that we want to take, maybe we can put NSODA in the forefront. Then we see how to galvanize our resources, especially financial resources. We see first of all, what can we as people put on the table before we start looking for funding sources. Like that, when we are going to financial institutions, at least we will show them what we have already raised. With NSODA being at the forefront, a registered, I think like that it could help push things further. If not, like for the agricultural venture, we can talk for 1 year, do feasibility studies for 1 year, and there would not be anything concrete. So that's my suggestion. Thank you.
Thank you so much for that input. Ray, I see your mic is still not on. I'll just allow Dr. Gilbert, I don't know if you wanted to come in. Your hand is up.
Yes.
Okay,
hello?
yeah, we can hear you.
So you are getting me?
Yeah.
Just coming back to some of the comments concerning the COVID issue. There were questions about washing of hands, how we can facilitate that. So the major thing behind this thing, the picture you are showing now just shows the virus with these red buds. That is the shell which is destroyed by soap. So the most practicable issue would be in each household to have 2 buckets. 1 bucket with water with much soap, and the second bucket with clean water to rinse the hands. So anyone going into the house has to wash the hands with the water. With, if you have Omo, you can dilute it so you don't need to always be changing the water. Wash with this one, and then cleanse with the clean water and dry your hands. Let the hands dry in the air. Don't dry them with a towel, because 10 people will share a towel, and which will mean you can transmit the virus that way easily. So that is the most practicable way. Coming back to the issue of having buckets and taps on it, and maybe having them on the streets or on the junctions, I am not a friend of it, because the example of what is happening in Bamenda is this. The government or the council places such buckets and hires people to be filling them with water. And the question is, where do they get the water from? They go to the next stream, and you know how the streams in Bamenda are looking like. Carry water from there. If these people don't die because of COVID, they will die because of typhoid or any other disease, because they receive this disease from the dirty water they use to clean their hands. So I wouldn't buy the idea of having buckets with taps. So now, Warren talked about the traditional rulers, and in my close contact with people back home, the initiatives in almost all of the villages with our village councils is that the health centers have contact with the fires, with the shoe fires, and with the medicine men, and they are doing sensitization, so it's a matter of hand-in-hand working. And as Dr. Robert already said, it's a matter of doing prevention, not doing cure. So the traditional rural healers are also coming in to play a part in sensitizing the population and in sharing the information about prevention. Full stop.
Great. Thanks so much for that contribution. I think, unfortunately, Ray has his hand up, but we cannot hear. We cannot. He's still. Yeah. His mic is not on.
No, Ray is on. He can hear us. He's unmuted himself.
But he cannot speak.
He did not connect on audio.
He did not connect on audio. That's the problem.
Okay.
Yeah.
He pressed the bottom left key on his computer or phone, and joined via audio.
Mm-hmm. So I think this is definitely all from the two speakers we had for today. I think I'll just take this opportunity again to thank Takufo, Clement, and Dr. Robert for these great two presentations that we have had. And I'll remind our participants, maybe those who noticed Ministry joined later, that all of this is recorded and we'll share that on our YouTube channel. And for those who have not been able to make comments and we want to comment more, I did notice someone suggesting about a committee, especially the aspect of agriculture. This is the kind of energy we want to build and take opportunities that technology has given us to be able to connect from our different homes and start seeing what we can do. So we'll be able to maybe join committees and of course have online conferences and keep these very important and vital discussions going on. It's really been long. We started at 5. We're already running up to almost 3 hours, and I still see we have 55 members here. I really want to thank everyone who has been patient so far. What we wanted to do at this moment is to just revisit some of the questions that we had and we couldn't answer immediately during the last presentation. But before we do that, I think maybe we just say 2-3 minutes if people just want to stand up and just relax a bit. I think it's really been long. I think that would be very important. Yeah, so maybe we'll just give ourselves 2-3 minutes and yeah, the President General will just answer some questions briefly on what we had, and then we also have a follow-up of what we did. Dr. Gilbert is here and he did some follow-up in regards to the insurance, which many people did show interest. For us here in Europe, we'll still be having further discussions on that, but I'm sure the general reform definitely wants to hear more. So let's just say in 3 minutes, we are 55 now, so at 58, we'll be back, and the president of NSODA will just go straight to the questions that we had, and then we'll hear from Gilbert, and then we'll wrap up for the evening. So see you all in 3 minutes. Great. Thanks for those who are still here. I think, yeah, for me, I think let me see. I think you have those questions with you, or do I need to bring them all?
No, I have them. You can bring them up, so that will be.
Okay, let me try to have to bring them up as soon as possible. But while I'm doing so, I think yeah, you can be looking at the. You can go ahead already with the first one since you have them, so that our people don't wait, continue to wait longer. Yeah, great.
Yeah, from the last online conference, there were a series of questions, and I'll just look at them. The first one is on culture, and the first question is, why is the fund not installed, and what can we do about it? And I must say that this is a very intriguing question.
All right.
I'll try to see what they can do, what they can answer. It's very true. The fund is out of sort, and all of us know why he's out of sort. And as you can see, there are lots and lots of things that went wrong. And for the fund to come back to sort, there are lots and lots of things that we have to do. But I won't go into details. There are lots of things that are already going on. There's a lot in the background. And many of us will be consulted along the line. But as you know, the fund is so, and so is a fund. And the way the fund went out on so, the fund cannot go back to so just like that. There are lots and lots of things that have to be done. And I can assure you that there's a lot already being done. And many of us will be consulted in one way or the other. And I think one of the main reasons why surface was set was because things went wrong in so, because the fund is so, and we all of us know the importance of the fund. And we know that the fund is a truth. And we know all what happened. And there is a lot that needs to be done before the fund goes to so. And all what I can say is that there's a lot going on, which I cannot share here on the forum, but I'll be contacting many of you on this, and some other people will be contacting some of you relating to the fund going back to so. And as we know all, there's still a lot of insecurity in so. But rest assured, a lot is being done to get back the fund to so. And the second question is, how can we be talking about surface when the war is still going on? Even in our culture, during the tribal wars, we know that when there's war, there's still planning. People still plan during war. And it will only wait that when war is over, I'm sure why we thought that thing.
Hello. Hello, I don't know if you can hear me. Your connection is poor at the moment, and it's quite difficult for all of us to hear you. If you can hear me, President. Unfortunately, that is what we have to live with when we are using technology instead of sitting face to face. So I hope you all can understand. The president was answering the question on surface. So let's hope the lines give him the opportunity to come back and answer that question again. He's currently off. Yeah. But I think just in general, while waiting for him to reconnect, I think they just emphasize so first is, yeah, we can, as he's saying, we can wait till the end and then we start planning, because that's quite too late. I noticed the president is back in now. Your line did go off, so I was trying to manage.
Yes,
from where I started. Please.
I'm very sorry.
Yeah.
Okay, I'm very sorry. We have a horrible network all these days.
Yeah.
So as I was saying, if we really want to wait, it will be too late. It's not only Nsaibirni people planning, many other communities around the Northwest and the Southwest are already planning to see what they can do now while waiting for the war to be over. And, conference so that we can get all the possible ideas do now. Third question has to do about definition of titles. Why is it different today? I think the issue of titles is a very, very big issue.
Unfortunately, the line is not helping us. Okay, what I will try to do is maybe to help us moving. Dr. Gilbert, can you hear me? Dr. Gilbert, if you can hear me, and maybe you can unmute.
I'm getting you.
Okay, great. Yeah, I'll just say, I hope this is not coming so fast. I just wanted us to go straight to the, we'll just try to get back to Formi maybe after you. So maybe you did a follow-up for the insurance, and I'm sure it's quite interesting. Many people would like to know what happened, their input. I know you already sent a very brilliant documentation for those who read and maybe will have questions. Dr. Gilbert is here in person, and he's a very resourceful person in regards to the two insurance schemes that are available in So I'll be asking everyone to if you have questions in regards, you can bring them up, and maybe Dr. Gilbert will want to just first of all give a very short discussion on the paper he sent out, and then we'll just see if there are any more questions, and we'll listen to you, and after that we'll come to Formi. So go ahead, Doctor, the floor is yours.
So to begin, I share what you are seeing now on the video. Are you seeing it?
Not yet. It's coming up.
Are you seeing the screen now?
Yes, we can.
So just to begin, that is a document which is going to talk about health insurance, specifying our situation back in Cameroon, considering the fact that we still have this crisis going on. And as for me, Stephen is saying, we cannot wait until everything is finished before we start planning. We must do it now, or else we are going to lose everything we have got. So I just go directly to the section of the concrete proposed plans of action, what each and every one of us can do. So anyone who has not yet got this document can get in contact with me or with the president himself, and he can share this document with him. So going down to the concrete actions, I think that all of us could be role models. There are many people, if I say I'm a medical doctor, and I advise everyone in Kumbo to go to the health insurance, and I myself am not a member, the people won't believe in me. So if I go to become a member, it will make many people who know me to believe in these insurance schemes. And I am appealing also on the second point on all the institutions, and so be it churches, mosques, schools, traditional leaders and their families to join BEFA or Kumbu Mutual Health. And then we have a very nice tradition of Ngwa, or what you call Njangi. And we have Njangi for all kinds of things. When children are going back to school, when people are preparing to buy fertilizers to use in the farms, and all the things. And why should we not also make Njangis for BEFA or for Kumbu Mutual Health? And we sitting out of the regions, we have seen the devastating pictures of people who are staying in the bushes. We're sitting out of the regions, meaning not being in the northwest west or in the southwest province or regions, living in Douala, living outside of Cameroon, could sponsor families. And sponsoring families mean you register a family of 4 people and pay 18,000 francs a year, and they can go to all the institutions, almost all of the institutions, be it health centers or hospitals, be it Catholic, non-Catholic, government or private, are collaborating with the health insurance scheme. So you can help these people to access all of these health insurance, institutions by sponsoring them, paying 18,000 francs CFA for a year. Then I discussed with the insurance schemes and would like to advise them to introduce the 5th point. That is what I call honorary membership. That means amongst us, there are people who are ready to help the insurance scheme to keep it going. And why not introduce the idea of honorary members who only simply pay to support for the system to grow, and put them in categories saying anyone who is able to support the insurance scheme with more than 500,000 francs a year is an honorary member of gold level. Anyone, for example, who is supporting between 250 and 490,000 CFA is an honorary member of silver level and bronze level. And these are only proposals, they can still adjust the levels. So I discussed this with the health insurance schemes, and they find it very, very interesting. So as I'm saying in this document, you have conditions of joining. Let me go up to conditions of joining the BEFA. The issue of Kumbu Mutual Health, I couldn't get any specific conditions at the moment, but I'm in contact with the lady who is in charge. And you have conditions of joining. Let me go up to them, showing you that a member family with 4 persons pays 18,000 in total. With 5 persons, they pay 22 progressively. So these are affordable amounts, and I would like to call on all of us to register ourselves. One other very important issue is I, sitting in Germany, can be a member also, pay 18,000 for my family, although I know I would never go to Cameroon to access any of the health institutions. But in doing so, I am supporting the whole system. And an insurance scheme like BEFA or Kumbu Mutual Health with only 6,000 or with only 9,000 members is not able to do anything. So being able to do anything, like, for example, countries like Germany where everyone is insured, you must have at least 1 million members. So with 6,000 or with 9,000 or with 15,000 members, these people are still far away, way long to go to attain the goals. And I think we sitting out of the regions have a big role to play. So I'm ready for any question which may come.
Okay, great. Thank you very much, Dr. Gilbert. So I notice, I'm just trying to catch up. I notice, I'm sure that's Fomi Takwa, he had his hand up earlier, and after that, Lamal Pele will come in. So if you can hear me, Fomi, please go ahead and make your contribution.
Thank you very much, President, and I want to appreciate the 2 presenters today. And as we move around, we are all aware that we are getting closer to the reality. And I just want to say, as I was sitting down, and when my line went off a little bit, you know, somebody just texted me and was just asking, how does this relate to what is happening around? And I said, it relates 100%. Exactly as the previous speakers have mentioned, we have to begin planning now. And so, Takafu, you did very well when you mentioned that after every crisis, there's always this moment to say, how do we then move on? I remember the government was already flagging lots of things, though in a way that did not bind, talking about disarmament and changing the guns and the spears for plowshares. That means all that talk, whatever they talk of disarmament or whatsoever, is going to be, what are the alternatives that we're going to be putting forward? And that surely agriculture will be one of the areas that we'll look onto. Time for me, just I also made a presentation, indication of the horrible humanitarian situation that our people are going through. And I'm also, as I was reflecting, I'm thinking that this COVID-19 opportunity should really, remind all of us again that there's a huge unattended humanitarian crisis that is still lying on the people's heads. And COVID now, like a conduit, we can use it to look at other aspects and begin to build, advocate for all these are people, the ones in the bushes, like former president has already said, the ones in the urban centers in Yaoundé, Bafoussam, and all the like. This is the moment to begin to package some of those and see how we can weave it to say, what then are we going to do now? What can we then do in the next 6 months so that we begin to pick up a few things while waiting, so that by the time the crisis, there are windows of opportunity, we are already defining something for ourselves. Rather than somebody coming tomorrow to almost impose and say, this is what is going to happen, we'll have already been ahead. And so I just wanted to link that and to say, this is very, 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 very tasking for all of us. And I felt so touched when I saw families, and I've been seeing some other images, families in the bushes. And I'm just wondering whether, even when we talk of COVID, they would just say, they will begin to look at their problems so big, like what we experienced here in Nigeria, where somebody went to one of the IDP centers and was talking. And the person shouted to the authorities saying, I don't care, I'm already even a dead body, I'm just already dead, already moving around. All I care for now is food. If I don't eat, don't tell me any other story. And sometimes as an official, you are worried, why this reaction? But for that person, that's the way it is coming. And so we who are the leaders, who have the opportunity to be planning, really have to move a little bit and with the same spirit and really begin now to come up with plans. No plan can be perfect, but let's begin to, putting something in the health basket, because health first. We are all seeing that with COVID now, we cannot do any other thing if we do not address our health issues. And that is an opportunity for us to now lay a foundation for the rebuilding of our communities back home. But beginning with health, I think that strategically and using all denominators, I think in beginning from the health is a soft area that people will understand, no matter which side of the struggle that we are having now. So I think it's a good opportunity. I just wanted to add my voice and to thank those who have contributed to say, let us begin to link all these ideas together. And I like the way Doc has just come, Dr. Gilbert, you just come with a plan. I think all of us fall back, begin to say, what next? So that we can help and then put something in front of the president of NSODA to begin to come up with an overall framework. It shouldn't be perfect, it shouldn't be bad. We should see something that's guiding us with some objectives that we are setting for ourselves within a very short period, and then how we can take it forward. So that when the debate that's already started about reconstruction and with all the differences going around it, when we begin, let us always have something in mind that in first, it also means that we are not going to wait for anybody to come and do something for us, because it's about our lives. When we take that ground and take that ownership, then we will be instituting a new phase in life where communities and people will define what they want for themselves and not somebody coming from us. That will also help in us, using some of those soft spots, soft entry points to begin to address some of the core issues that we may not be able to deal with as NSODA, but as communities. But we use these soft spots of agriculture, of health, and maybe next time we talk about education in one way to see how we begin to, unpack these challenges ahead of us. So I just wanted to add my voice and thank all of you to say this is the way forward, but that it is time for us to, put all this and begin to move towards the path of action. Thank you so much.
Great. Thanks so much. For me, it's also one of our members in the team, the first vision, and contribute so much. He did a presentation last year, so thanks so much again for that contribution. We still, I'm sure, I see Lamar Pele and then Ray. Ray, great, you came back. Your audio was not on last time. We didn't have you, that's the reason. So I'll just let Lamar Pele to speak, and after that Ray, and hopefully you'll have questions for Dr. Gilbert in regards to the insurance scheme. Go ahead, Lamar, if you can hear me.
Yeah, I can hear you very well. I just want to confirm also if you can hear me from your end.
Yes, we can hear you.
Am I being audible enough? Okay, thank you.
Right.
Okay, just before I proceed, I would like to thank everyone for their participation and mostly to the people who brought this initiative to bring and so people together worldwide. And I will just talk mostly on COVID, the issue of COVID, since we are planning to prevent this kind of deadly disease that is taking millions, thousands of people all over the world. I think when it comes to NSODA, we don't yet have any case, and maybe in Northwest as a whole, if I'm not mistaken. And so we are talking about COVID now, especially in NSODA. We're just still talking about preventive measures and all those things and planning. So I just wanted to know if we, in the planning stage, if we, few points I wish to just ask the people in charge of this. So should in case, God forbid, but should in case if NSODA is hit by this invisible enemy, COVID, will NSODA be that competent authority to supersede in decision making about how to, like, we already have the task force in place from NSODA worldwide. So will these people be the people to supersede the planning, the implementation, and guidance to this, to the NSODA people in particular, or in NSODA in particular, or we will still have to depend solely on the government? I think, and everyone knows that most of the government officials, they have little or less impact now in the people in those regions, given the political situation of the country, which everyone knows. Okay, if NSODA will be the one to supersede and be and be the one to take decisions on how to combat this. And secondly, do we already talking about planning again? If we already have, we know that we are not like China and other countries whereby they within the space of 10 days or 15 days, they could set up structures for people that already, like for the victims, for the patients, the screening centers and everything. We know that we are far behind that. So should in case, God forbid again, but in case that happens, are we already thinking about places where we could reserve, like some already existing infrastructures that might not be in use? For instance, in Tobin, it's been a while, I was in Kombu, by the way. We used to have this secretariat building. I'm not sure what is its current situation. If we've got some of those existing infrastructures where if something like that happens, we could try to mobilize and have them as temporary places or areas where we could have these people, affected people to be put there and then like quarantine or for medical assistance and all that, to avoid them mixing with other people who are still free. Like what's happening, of course, we've seen how people are. One of the preventive measures is isolating the people who are already infected from the general public. So we already having this kind of planning in place. And again, is it sort of task force that is going to supersede in all this to see that these things happen accordingly? And then talking lastly on support. We all know that this what from 2016 the whole place have been. If you see some pictures even of home, you will feel you start shedding tears. So we know already that it's very difficult for people to raise money even back home. Talking about personal protective equipment, are we going to have a separate initiative for that? And mostly people who are out of Scotland, maybe somewhere in the diaspora, even some of them in Yaoundé, Douala, like back home. If we are going to be the one to come up with initiatives and contribute money and try to see how we could be getting these PPEs in place in case, especially for the medical team, the doctors and nurses and everyone who will be at the forefront should this thing hit us, God forbid again. So I think planning, we should try to consider all of those things as seen other countries putting them in place to prevent, try to control and contain this invisible enemy. So not to take much of our time, that's just the little thing I wanted to chip in, and wish to, if we can have clarification for all of those. steps. Thank you very much.
Thank you very much. Yeah, I think I'll just answer that immediately just to clarify it so that we don't take so much time. No, not actually. I think just like we said, I think in the presentation, it did come across that the point is just one NSODA wants to take an initiative so that we don't wait for long. We don't know how long government aid could come. And then the other thing is, I don't think so that can be the situation where they can. Whatever thing we're doing under the task force in the discussion is more of to offer any support, to complement whatever thing is coming. And I think so that it doesn't have that power because it definitely belongs under an authority, and they will have to follow in line with that. So, and the other one of, so the major aspects, if you did see the 2 points that we had, is more of sensitization, prevention, and working with maybe, where possible, support health institutions. You've raised the issues of maybe if we can maybe quarantine areas. I think that can be in a situation where I think that can also not be a decision that can be made by NSODA. So whatever thing we do, we just want to ensure that let's be doing something before waiting when the other help will come. So I don't see that being the situation we can have. So I will just allow Ray to speak. Ray was the next person to speak, and I see some 2 hands are still up, but Ray, please go ahead and speak. Ray, if you can hear me, or fortunately, he's just gone off again. Okay. Some 2 hands are up. I'll allow, I think there is some, okay, I see. I'll just allow Gilbert, I see your hand is up. If you make it short so that we speak to hear from, I see Alcatel one touch so that for me feel complete with the questions and we wrap for the evening, that would be great. Dr. Gilbert, go ahead, please.
So thanks for the questions. I'm trying to answer also the questions of Lamar Pele. As Gilbert has already said, NSODA will not be able to take charge of all the things which we're asking about. But what I think should go ahead is, as a big message, is the private health institutions which are at a place. We have BBH and we have Shisong. Joining hands to support them will be the best thing we can do, because they are the players at the ground. They have gone through this time of crisis and they know what's really happening. And authorities which may help to support them are the religious institutions like the dioceses, the Presbyterian Church, the Baptist Church, and the Muslims. And I see in all what I've been doing, all these coordinating their activities together. The issue of quarantining, it is unlucky, but it is lucky that we have boarding schools around. I have not talked with any person, but I think all these schools are empty. And should it be that we are massively attacked by this COVID, my proposal would be to these institutions and to those at the ground to make a provision for some of the dormitories to be placed in the position of us being able to board the patients in these dormitories. Then I would advise the institutions to select the part of their staff, only those who are young and are healthy, to go take care of these patients. What we can really do in terms of support, that was our third question, is I think that we, being so out of the country and being so out of the regions, could do fundraising to support directly BVH and Shisong. No matter what we do, if we tell them this is 100,000, this is 1 million for COVID or for the crisis, these people are doing a marvelous work and they need support from us sitting outside here. So that's my stance on the issue.
Great, thank you for making that complete. Let's just hear from Alcatel One Touch. Unfortunately, I don't know exactly who that is. Please, if you can hear me, you can unmute and go ahead and make your contribution.
Banjika, I think Dr. Onku Eugene has been wanting to say something. I tried to pass on a message, but I'm not sure you saw. So yeah, if you just give him a call out, he would want to make a comment.
Okay, is that for me, Takwa? I think. Oh,
Is my voice coming through now?
Who is that? Sorry.
It's Ray speaking.
No, it's not Ray. After it's Uncle Eugene.
Yeah, Uncle Eugene, if you can hear.
Yeah, I was just checking. Thanks.
Yeah. Uncle Takwa, okay, if you can hear me, he can come immediately, then we'll hear from Ray. So Uncle Takwa, if you can hear us, go ahead and unmute and talk. Maybe he left us.
No, I can see a Takwa on here.
Okay, let me see. Please, if you can unmute, let's see.
I'm trying to unmute them, but that's not happening.
Okay.
Can you try?
Let me try from my end. Okay, I'll have to unmute all, maybe. I'll unmute all and let's see if we get this going and then bring him. I'm sure definitely we'll like to hear from him.
Young man, so now the first thing that is young.
Okay, it seems like
no, it's not.
Yeah, it didn't work. I was not able to.
Not that last time we go.
Sorry, let me
Not that
just
last time we go.
mute everyone back.
That time, that 2
Sorry. Okay, so we're not able to take him immediately. Let's just we'll surely come back to him if that happens again. Let's just go straight to Ray. Ray, please go ahead and speak so that we have our next speaker. If you can hear me, Ray.
All right, you hear me now?
Yes, we can hear you now.
All right, thank you so much. And yeah, is for me back or is out? My comment first of all was to Dr. Gilbert. I think he kind of answered the question on the insurance scheme, because I was just eager to know if the insurance is run by the respective hospitals or is run by a different entity. And like he said, insurance is a game of numbers. If we don't have the numbers, it's kind of difficult sustaining it. So I just wanted to know, I have very limited information on it, if whether the insurance are managed by the hospitals or by a different entity altogether. And if so, what is the kind of, let me put it, this kind of mentioned that I would just more information, if you could designate more information on, how the insurance works, the qualification and all of those, so that once people are more informed, people can make informed judgment and decision on how to participate. Like he said, many of us here would love to kind of, register some of our folks back home and kind of encourage them to do all of those health checkups, regularly. That will prevent a lot. And then the second comment I'm trying to make here was to inform me and just to echo the fact that I was delighted to hear him say that there is a lot of efforts that are being done to kind of get the fund back to the palace. And it's one of the things, like some of you know, that I just thought, if we can be doing some of those little tangible things that are kind of affecting the life of people right now at home, building on this, on the future of so will become much more appealing to several persons, because they will be seeing what we are doing, and that will be a motivation for engagement and commitment in the plans that we are developing. And I watched the pictures it showed, and it's horrible. It's horrible to say the least. And one of the things, thank God they are even in the bushes, because that's kind of like a situation where they are cut off to a reasonable extent from this COVID stuff that is, ravaging all over the world, particularly in urban centers in Cameroon. And the situation they are living, some of the things that we're looking at could be to manage the access to those places. Make sure that people who are going there, who are coming from the towns, are kind of healthy enough not to go contaminate those our people who are living in the bushes, because they are safer there from the COVID than those of us who are living in the town. So if we could look at some of the tangible ways just to make life a bit sanitary for him, they may not necessarily
just for example, I'm not saying that this is that this inform about it. They may not necessarily need things like masks, because if we can, you know, just treat them there and provide them, that would be great. And I should come back to the third point, which is doing some of those actionable things now that can kind of just mitigate the suffering of those people. If those people, we are able to kind of, you know, take tangible ways to, I will send you some of the things that that I kind of drafted, you know, just to see if, you know, action could be taken in those direction to see and see how we can just slow down the pace at which, you know, people are being impacted. You know, it will be very helpful for this great initiative that we are doing. And, you know, lately I hear some of the killings, the Amber Boys just killing themselves, and it kills me. And I'm just like, if we start doing this to ourselves, how far are we going to go? So more of a lamentation, and I'll take off my my mic from there. Thanks so much.
Yeah, I think the question that I did get was especially the one regarding the insurance scheme. I think maybe I know Dr. Gilbert already did something in that. Maybe if you can just make that brief or say where that information is, okay, for someone like Ray who needs it or appreciate it. Just
so,
yeah.
Are you hearing me?
Yes.
Ray, I've just sent you information directly to your email on the insurance scheme as information. The major thing is the insurance scheme is independent of the hospitals. The Kumbu Mutual Health is an initiative of our Ms. Sanjong as Municipal Administrator of Kumbu. So after that, it is supported by the GIZ, that is a German institution which is helping in technical developmental work. So the issue of the BEFA, Bamenda Ecclesiastical Province Health Insurance, is an idea of the bishops of the ecclesiastical province, and it spreads all over the whole of Cameroon. That means, if you are a member, you can access health institutions in the northwest, in the southwest, and in the center, and in the presently in the littoral and in the southern province. So information at any time, and you can also get it through Banjika as a document. Okay. Hello, Gilbert, we are not getting you.
We can't hear you.
Sorry. Okay, thank you very much for that. I was speaking on mute. I was just saying that I would like us to hear from one Alcatel. He had his hand up. At least, please, if you can hear me now, you can go ahead and speak, because I can't see a name. That's why I have to say one. Alcatel, one touch, please. You are on mute. If you can hear us, or let me unmute. Alcatel, one touch. I've unmuted you. You can hear us. Please go ahead and speak. Okay. I'm trying to look where the other noise is coming from. Okay. Yeah, unfortunately. Okay, that's right. Unfortunately, we cannot hear from one Alcatel, and yeah, we really wanted to give questions that were raised up during our last conference call. For me, was working on that, but unfortunately, due to technology and doing virtual conferences like this is what can happen. For me, has not been able to give us those questions, but those answers. But I would just want to emphasize that our conference call, one will be coming up again. Once that date is decided, and we can come back to those questions at the end. Now, the other thing here is, right, I think basically, if there is any other person who wants to say, who has any general comment, not necessarily on the discussions we have had today, but if you have any general comments that you just want to throw in here, or you have something you wanted to contribute but has not come along the lines of what we are discussing today, The floor is open, so please just make some comments for us, and let's just say a minute if you want to do so. Just make it 1 minute, don't take too long, because we're really 1 hour 40 minutes behind, to almost 2 hours than our planned scheduled time to stop. It's really been a long day. So if you're making a comment, please make it one. And if you have not joined our WhatsApp group for the First Vision, you can indicate always. A feedback survey will be sent out to just get input on what we have done. You can also indicate on that survey, and we'll be very much appreciate how we did do today, so that we keep improving as we go along. So I notice, Godlove, you have your hand up. Please go ahead and give your contribution.
Yeah, hello once more. My contribution is that the health committee and the agriculture committee must work hand in hand, because as we all know, most people, especially in our villages, die mostly because of malnutrition, lack of food, because there are people that can't even afford 2 square meals a day. Worst of all is during this crisis, because I have come in contact with so many people who can't even afford a tin of corn to eat. So this agriculture committee must not start with something big. We may even start by trying to come up with various schemes of how to make food available to people already in the bushes, coming up with good initiative of how to harness what the farmers who are struggling at the moment are trying to produce. Because now we have a problem that there are people who have food to sell, and the people to buy are not even there. So now this health committee can try to work hand in hand with the agriculture committee, so that we try to come up with solutions and ways to attend to the needs of the people. And another thing is health, because I have also come in contact with a lot of people who have a lot of health issues, and they can't even afford tablets or afford basic health care. So we need to look into those kinds of issues, whether to do like a phase 8, local phase 8, and install them in local communities, or maybe in the bushes where the people are, so that we try to tackle the issue of food and healthcare in a holistic manner. Thank you very much.
Hello?
I'm done.
Okay. Are you getting me?
Yes, I'm getting you, Dr. Gilbert.
I would like to jump in into this issue. Back at home, there is much happening. We should not underestimate the actions of the health institutions which are already there. So almost every village has got a health center or a health post, and they are linked and are collaborating with the hospitals. So to me, it would be a great initiative if we could support those who are already at the ground doing the work. So we don't need to put any first aid stations anywhere. We don't need to start reinventing the wheel. We simply need to support those who are already at the ground. If we give support through Shisong, if we give support through BBH, we are done. So the best support we can give, not knowing whom to go to, is by joining the health insurance schemes or by registering all these people who are around. If I go to the bush and register 2 families which are there, I don't need to get them to go anywhere to be registered. I need to call in the hospital or the health center and tell them the names of the people. They are registered, and anytime they have any disease, they go to the health center and they are attended to. And the health centers and the hospitals are doing what we call outreaches, going to the people who are living in the bushes, as we saw in one of the pictures on FOMI, where they attend to the patients, and they have days where there is free consultation. So patients who come from everywhere to consult for no money. It means these hospitals and health centers are working on a big deficit, notwithstanding what has already been there due to this crisis. So the only support we can do to them is to support those who are there financially by letting our family members be registered in the BEFA schemes or in the Kumu Mutual Health schemes, or registering ourselves in all of these schemes? Thank you.
Yeah, thank you very much for that input. I lost my connection a bit, so I missed that, but I came back and heard you. So thank you very much. Yeah, well, also we'll be wrapping up very soon, and I think, yeah, Pamela is here with us, and I'll appreciate if she comes in and also say a word or a comment on this while before we go ahead and close. Pamela, if you can hear me, please go ahead and do so.
Thank you very much, President. Thank you, Banjika, for organizing this meeting. Clement, thank you so much for a very detailed presentation and bringing in, you know, the food angle. And also thank you to Dr. Robert Nsaibirni for bringing in the COVID issue and for every other comments. I've been learning a lot throughout all of this. But it got me thinking about one thing that I just quickly wanted to mention, because there's been a lot of talk around maybe creating, the idea of cooperatives was really great, because I know a lot of people from the 60s and 70s who benefited from those initiatives. But I think that we're talking more along the lines of creating new other things instead of re-examining the ones that we had and maybe resurrecting them, or ensuring that we have the right sort of leadership to ensure that they're managed properly. I'll give an example of WE that was created a few years back, and that was on Shunjov with an investment holding. And that was also around a lot, involved around farming and all of that. So now you don't hear anything about that one anymore. And a lot of people put money in there. So, you know, there are investors who haven't heard anything about their investment. And the only response would be like, oh, there's a fighting. So it affected a lot of the farming activities that were linked to that initiative. And then now we're talking about new ones without actually seeing how that one should work. So my suggestion would be that so that can't solve every problem for us, but they can be the organization that every other organization rallies behind, and we all put our heads together to find solutions, working in collaboration with the right institutions and you know, organizations already on the ground, already doing this job, so that there's no duplication and we don't need to start afresh again. So that's just my 1 cent. Thank you.
Great. Thanks for that input. I don't see any other hand up. I would just want to give this opportunity. I'll just ask Dr. Robert, or any other person from the first team who is here, who wants to give another word before I round this. I'll appreciate. So please, if there's anyone, just go ahead and give a word. Anyone from the first team. Junior, I see you are here. You've been doing a lot of publicity for us and really helping carrying the message where we need to see it. So if anyone is here, please go ahead and do so. Thank you. Can anyone hear me?
We're getting you.
Yeah, President, we can hear
Great.
you.
Okay. So
I mean, I think we've learned a lot, and the discussions have been very fruitful. I've taken down so many notes. I've seen so many other questions coming up in the comment section. I mean, I think it's going to be, we have a lot on our plate now, so that team, and I think we are on a good footing. Thanks to everyone for participating, and thanks for all the comments.
Great. Okay, regarding, I'll just go ahead and say, thank everyone again for being here. We started very high. We have been on that same level. It's a great second conference that we've had. I think we apologize again for not being able to manage the time and finish early, but I think it was worth it. Maybe it's because we'll try to be better next time. We did cut the presentations to 2. And unfortunately, we are still finishing this late. So we want to emphasize that everything cannot be said online, and the discussions cannot also be completed online. So I appreciate if people take up that responsibility also and come in the committees. I'm glad to see that Onko was asking about committees. So we're trying to have actually those committees working, and please come up immediately if you recognize an area that you want to contribute. As the president of NSODA said, and Dr. Robert also emphasized, NSODA is us, and we are NSODA. So it's all for us, and everyone is welcome on board. I thank everyone again for this great day, and as well as thank the speakers. We'll close officially here now, and after that, the Zoom conference call will be open. So maybe if there are some people who have seen friends and they want to catch up before they leave, that will be very well fine. So thank you everyone, and wishing everyone a great start of the week, and stay safe, and hoping to see you definitely soon in our next conference. Yeah.